I want to talk about the inpatient process when someone is in a crisis, when someone is in a mental health crisis. Christian, if you could help me out, what does that inpatient process look like? What happens when someone is in need and is admitted to the inpatient facility because they're in danger to others or to themselves? And what does that look like?
Sure. Yes. I think you touched on two of the three criteria that legally that law enforcement looks at, and also clinicians look at to determine whether or not a patient is appropriate for being admitted. And as you said, it's being a danger to yourself, being a danger to others, or gravely disabled, meaning you're unable to take care of yourself with food and clothing. That's the legal criteria. And if you meet any of those criteria, you can be admitted voluntarily or involuntarily. So, for example, if you have someone who's having a mental health crisis and they're harming themselves, maybe they're cutting themselves, or they're maybe they've taken a certain amount of pills,
Mm,
that person can be involuntarily admitted, meaning whether either law enforcement is called, or now many counties are working on having non-law enforcement mental health resources come out in place of police officers. So these are teams and units that could assess and admit someone, or request for them to be admitted. Um, so that's the criteria that needs to occur.
yeah,
Once they're in the facility, it's a hospital setting, so they go through a normal intake process. They're given a clinician to work with them to really get down and find out what's going on with them. This is for adults and children, so even for youth, 12 years old, 13 years old, anyone 12 years old and older can consent for their own treatment if it's voluntarily. Again, if it's involuntarily, then there's no consent needed because they're a danger to themselves.
right.
Um, there's an adolescence unit. It's for Sacramento County speaking. There's an adolescence unit, a youth unit that's separate from the adult unit. And once you're in there, they can be put on three different types of holds. A 5150 hold is a
Mm,
72-hour hold, meaning they have steps, meaning within 72 hours, clinicians are able to assess you for that time to see how you're doing, right? So they give you three
right.
days to really see what's going on, see if your symptoms subside or if they calm down, and you get to a baseline. The next is a 5250 hold, which is a little bit longer hold where they can go on to a 5272. So you have a 2 week hold or a 30-day hold. So and the purpose of those holds are just to really assess to find out if more treatment is needed, more medications needed, and while the patient is in these facilities, they're receiving counseling. There's art classes that are going on. They're
Right.
receiving medication support. They're in communication with their peers if they consent for that. So if you'd like to continue talking to your family members, there's a big misconception that it's like jail. And you're able to talk to your family members. You're able to have visiting rights and things of that sort. You have privacy rights. Of course, they feed you your meals throughout the day. And then the ultimate goal is to get you to a point where they can connect you to mental health services before you're discharged. So that's the ultimate goal. So that's the inpatient setting
Right.
in a whole. And ultimately, the goal is really to get that patient to be stable where they can either be admitted to maybe outpatient one time a week therapy services. So, yeah. And also, just want to say that every county has a inpatient facility. So, regardless of what county you're in, whoever's listening to this,
Mhm.
whatever county you're in, each county has an inpatient facility that has access to these services.
Incredible. That's so good to know, because I think a lot of people have these predetermined judgments of what that means. Oh, my mom's going to go to a mental institution. You don't know what goes on in those institutions, or movies kind of portray this specific circumstantial, evidence that that's what happens in an institution. So thank you for clearing that up for us, Christian. Guys, this is really important stuff to talk about. We've learned a lot. We've gained a lot of tools today, just learning how to be strong and be vulnerable and share our feelings with people that we feel safe with, and amongst other things, hotlines, warm lines, all of those things, what are some final tips that we have for our viewers at home on how to pack their tools? What tools do we pack with in a mental health emergency? I'll start with Shamar.
Can you say the question one more time?
Yeah, what are some final tips? Final tips on how to pack tools for your mental health emergency toolkit. Anything you want to add to that?
I would probably just say don't be afraid to own up to your challenges. There's no other way to say it. Don't be afraid to own up to them, and don't be afraid to go to people. Nobody's gonna get ticked off at you just because you came and asked for help.
Thank you, Shamar. Richard, what are your thoughts, boss?
So again, just to reiterate, just have your circle, of friends and family who you can reach out to, who you feel comfortable with sharing your emotions. The text hotlines and a pet team in case you have a family member who is going through suicidal ideations. And I mean, most importantly is stay strong. It's difficult to do that. It's very difficult to do that, but maybe writing, that's another thing, writing your thoughts down. For some people it helps to for anxiety, write anything that's in your head at that moment, and for some people it calms them down. Yoga. Some people, when they're tense and because of anxiety, yoga relaxes some people, or try to do any hobbies that can calm you in any instant. Make a list. If you know that a certain person or that yourself, you have chronic depression or chronic anxiety, prepare yourself when you're in a good mental state. Write down what you can do and who to call for whenever you do get in that depressive or anxious state. You're kind of prepared.
Got it. So, and in case of emergency contact, if we could shuffle those hotlines and resources one more time as we wrap this up with our final tips, that'd be great to put these numbers back in to your phone or share them with a friend. The National Suicide Prevention Lifeline and other resources that we're gonna throw up there as well. Diego, what are your last final tips, boss? How else should we be unpacking or putting tools into our emergency toolkit for mental health?
Kind of to expand on what Richard said, yeah, it's good to find that outlet, whether it's expressing yourself through an art form or a physical, activity. I mean, that's good for your brain. You release, good chemicals that otherwise wouldn't, be there. I think it's important to have that balance, between, especially right now during this pandemic, of, going outside, getting some fresh air, doing some exercise. And then what he also said is about staying strong. I think it's important to stay strong, but also to know when to ask for help. You have to find that middle ground,
Absolutely. Thank you. Julio, what are your final tips?
First of all, thank you for having me here before I go. Just to remind ourselves that everything is temporary, right? I'm going to take a little bit personal. When we first started talking today, I said that, the young kid that I was never looked at things the way they are now, right? Being in front of all of you guys is something that I would have never imagined, having a history of suicide attempts and mental health. And I never thought possible that recovery and happiness was possible, right? Until I learned that all my emotions can be temporary, and I don't need to have a permanent solution to a temporary emotion. And part of the reason why I do this work is because I believe in the potential and the beauty that each and every single one of us brings to the table. Sometimes we get depressed and we get all these emotions because we feel that we're not good enough. I was given certain talents that I'm very good at that other people don't have. And some of you bring talents to my life that I'm not good at. And that's the reason why, so we can collaborate and we can count on each other. So reach out to people, know that you're not alone. And all our thoughts, our emotions are temporary. So that's what I.
Thank you so much, Julio. Glad to have you here. Glad to make a friend of you as well. Malik, what are your final thoughts, boss? You're muted.
So I think my final thoughts would definitely just be more about the focusing in, like everyone was saying earlier, the focusing in on these things that are going to take you out of that mindset and finding these different outlets of joy. And when you can't find them, figure out how to find them. Right? When I don't know what's going to bring, what's if nothing around me is giving me joy anymore, then going to search for that thing, or pulling back some of those tools from when you were 10, right? Like sometimes I know one thing that one of my friends do is color. Every time they have coloring books, they're a full adult, right? But this is something that used to bring them peace at a time and comfort at once before. So they're able to bring that back out and use that. And that's just to kind of help shift the emotional element, but it's also, again, making sure we keep these tools that we have and these hotlines, and calling people when we are getting to that point. But to help us from getting to that point, using these outlets of joy as much as often as you can.
Thank you. And having people to talk to and peer support is another tool that we can utilize as well. Christian, bring us home. What other tips do we have for our viewers? How can we put more tools in our mental health emergency toolkit?
Sure. I use a PSC model for a lot of the clients I work with. It's a PSC, and it starts with positive self-talk. So most of the negative thoughts and depression comes from the negative thoughts that go in your mind over and over. So really being positive, having positive self-talk, and saying that out loud. So you're saying it out to yourself, I am, and in a positive word. So you're really saying positive affirmations to yourself out loud versus in your mind or writing it down. When you say things, it goes out of your mouth, whether it's positive or negative, and it goes right back into your ears. So that's the concept of the P part. The SC is the self-talk part. So and you're really doing self-talk, and you're talking to yourself in a positive way that supports that, and you're also challenging those negative thoughts. And you challenge those negative thoughts that you have. So whenever you think I'm not anyone, I'm worthless, or I'm not good enough, or I won't get that job, challenge that thought. Why aren't I good enough? And then challenge where you think the source of that thought came from. Is that a thought that just came out of nowhere? Is that a thought from a past negative experience? So start challenging those thoughts that come to your mind. And then the last part is the C, which is culturally competent services. Everyone that's on this chat, most of the youth, you guys are in a great position right now because you have the ability to choose who you want to be seen by. And you don't have to just take any therapist that comes along that your doctor sends you. If you would like to have a doctor that relates, we talked about it all, a lot today about our culture and where we're from and being indigenous. If you want to have a culturally competent therapist or someone working with you, you have all rights but to request that. And I would encourage you to, if you need those type of services, you want someone maybe that's a male or a female, or maybe you want someone who's Latino or bilingual speaking, or they're Mixteco, which is the indigenous group that requires a different type of interpretation services outside of speaking Spanish. These are all the different services that you can request. You can take control of your medical rights versus a medical company telling you who you're going to see and who you're going to talk to.
Yeah, absolutely. And to wrap us up, guys, I'll add my last tip here is to seek out therapy when you are good and ready to do so. Therapy has definitely helped me in my life. It's been a huge tool in my mental health. emergency toolkit. You know, I'm dealing with things in my life right now that I can't go through alone. You know, like I said, my grandfather passed away. I'm dealing with a lot of personal things in my life, but I am stronger because I have a therapist that I can sit and discuss this stuff with, help me reorganize things, help me compartmentalize, and learn how to deal and manage with my stress. Those things are huge for me. So knowing that we all need help sometimes, and asking for help is a strength. To recap on what we talked about, use algae when you're approaching somebody in a mental health emergency. Approach and assess for suicidal harm. Listen non-judgmentally. Give reassurance and reinforcement. Encourage professional help, just like I just encouraged anyone to go to therapy if they're in need. Encourage self-help or other support strategies like the numbers and hotlines and warm lines and text hotlines that we gave you guys today. Just know that you're not in this alone. We are all here for each other. And I want to thank Richard, Shamar, Diego, Christian, Julio, Malik. Thank you for joining us on this chat. This was incredibly important. I appreciate you all from the bottom of my heart. I want to also thank you for tuning in to this episode of How to Pack Your Mental Health Emergency Toolkit. If you enjoyed this discussion and you want to visit more Brother Be Well content, please go to our website at brotherbewell.com. Again, that's brotherbewell.com. As always, I'm your host, Justin Martinez, signing off and always reminding you, brother, be well.